Hello dear students, welcome to Vet Innovation Classes Jaipur. I am Dr. IRFAN. I am going to teach you veterinary medicine. Let us start. Today we are going to learn about acute phase proteins, and trust me, in every examination, whether it is ICR JRF, it is ASRB NET, or any state PCS examination, many questions have been asked from these acute phase proteins. And in order to understand these acute phase proteins, I need your patience. So let us start. Acute phase proteins. What are these acute phase proteins? See, whenever an animal is feeling stressed or there is any inflammatory condition in an animal, our animal's liver is sensitized. When the animal's liver is sensitized, it produces some of the proteins in order to combat that infection. Or, for example, let us take an example of COVID. Recently में क्या हुआ, COVID की वजह से जब पूरी इन द होल वर्ल्ड कोविड का ये पैंडेमिक हुआ, तो उसमें जो डॉक्टर्स ने रिकमेंड किया, वो जब टेस्ट्स लेते थे, तो उस कोविड में वो कुछ मार्कर्स बोल रहे थे कि अगर आप में CRP अगर ज़्यादा हो गया तो प्रोबेबली कोविड का इन्फेक्शन हो सकता है, अगर डी डाइमर ज़्यादा हो गया तो कोविड का इन्फेक्शन हो सकता है. दैट इज द ह्यूमन पार्ट, दैट इज द मेडिकल पार्ट. बट इन आवर वेटनरी साइंसेस वी आर नॉट लैगिंग बिहाइंड. हमारे मेडिसिन में क्या होता है कि वेटनरी साइंस में, मेडिसिन में भी क्या होता है कि अगर एक एनिमल में कोई इन्फेक्शन हो गया, स्ट्रेस हो गया एनिमल में, तो उसकी वजह से क्या होता है कि जो एनिमल का लिवर है डेट गेट सेंसिटाइज्ड. वंस द लिवर इज सेंसिटाइज्ड, द लिवर इट प्रोड्यूसेड सम ऑफ द केमिकल मीडिएटर्स, और उन केमिकल मीडिएटर्स को देख के एक वेटनेरियन एक पैनल बना सकता है, एक वेटनेरियन एक टेस्ट की पैनल बना सकता है. ऑन द बेसिस ऑफ डेट पैनल a veterinarian can diagnose a disease. And in the current scenario, these acute phase proteins, these are playing a crucial role, these are playing a pivotal role in diagnosing the disease in equine world. Okay, so you need to understand these tests in order to become a good veterinary doctor. So in acute phase proteins, for example, what happens, this is a liver. I'm not good at drawing, let me try. This is the liver. Okay, liver of an animal. There are, let us take the example, these are some of the inflammatory agents, or there is stress. Okay, this liver, it recognizes this stress, it recognizes these inflammatory substances. This liver gets sensitized. When the liver gets sensitized, it will produce these acute phase proteins. Okay, it will produce these acute phase proteins, and with the help of these acute phase proteins, a veterinarian can make an accurate diagnosis. See, for example, we will take an example of medical patient. कोई स्टूडेंट है, कोई स्टूडेंट में एनीमिया हो रहा है, तो डॉक्टर क्या करेगा, जब वो डॉक्टर के पास जाएगा तो डॉक्टर विल ऑब्जर्व हिम थॉरोली एंड फाइनली वो उसको कुछ टेस्ट्स रखेगा, लाइक CBC रखेगा. तो कंप्लीट ब्लड काउंट जो होता है, तो उस CBC में आपका हीमोग्लोबिन आता है, उसमें आपकी RBCs भी आती है, उसमें आपका TLC आता है, उसमें आपका PCV आता है, तो डिफरेंट पैरामीटर्स, DLC आता है, डिफरेंट पैरामीटर्स उसमें आ जाते हैं. सो विद द हेल्प ऑफ डेट पैनल, डेट CBC, अगर हीमोग्लोबिन कम आ गया तो डॉक्टर बोलेगा यू आर सफरिंग फ्रॉम एनीमिया. Same are these acute phase proteins. Whenever there is inflammation in an animal, whenever there is stress in an animal, these acute phase proteins are produced by the liver. And using these acute phase proteins as markers, a veterinarian can make a good diagnosis of that disease. In order to understand these acute phase proteins, here you have to remember, and questions have been asked from there. These acute phase proteins are of two types. One is positive acute phase protein, okay, positive acute phase protein, and another is negative acute phase protein, okay. What is this positive acute phase protein and negative acute phase protein? See, when there is inflammation in an animal, and let's take an example of acute phase protein A. Arbitrary, we are making it as acute phase protein A. When there is inflammation and this acute phase protein A is increased, at that time we call that as an positive acute phase protein. Why positive? Because that is upregulated. Because of that inflammation, this acute phase protein has been upregulated. And when you will make a panel, when you will go to the diagnostic laboratory, and in the diagnostic laboratory you will see that in normal, for example, I will take an example. There is a positive acute phase protein called serum amyloid A. Please remember, this is a positive acute phase protein. Serum amyloid A. Okay, this is a positive acute phase protein. There are many positive acute phase protein, I will tell you later, but in order to understand get a feel of this, what is this acute phase protein. So in equines, in normal healthy equine, you know horse, in normal healthy horse, this serum amyloid A, the concentration of this serum amyloid A is 0 microgram per ml, means it's absent in normal healthy equine, okay. In normal equine, the concentration is 0 microgram per ml. But for example, an equine case comes to you, a case of strangles or a case of equine infectious anemia, a case of Durine, different examples of equine diseases. A case comes to a veterinary doctor and the doctor makes a panel. Doctor will suggest to you, please go to a veterinary laboratory and get this serum amyloid A done. When you will get it done, and you will see that the concentration is going up to 20 microgram per ml. So here you will suspect that there is some sort of inflammatory condition in the equine. So this is the marker, this is the diagnostic marker that is helping a veterinarian to make a correct diagnosis. Okay, understood what is this positive acute phase protein? Because this protein has been increased because of the inflammation. That is why it is known as positive acute phase protein, because it has been upregulated because of this some sort of condition in the equine. Here the condition was, for example, here the condition was strangles. With the help of because of the strangles, this serum amyloid A, it has been increased, it has been upregulated from 0 microgram per ml to 20 microgram per ml. So here it is a positive acute phase protein. Remember, here you need not to remember this no need to remember the concentration. Please remember only the examples, and these examples have been asked. Okay, these examples have been asked. Please remember. I will highlight them. Positive acute phase proteins. First one is serum amyloid A. Okay, serum amyloid A. Okay, this is the positive acute protein. Second one, heptoglobin. Third one, CRP, very much discussed in COVID positive patients. This is C-reactive protein. Okay. Fourth one, RBP, retinol binding protein. Retinol binding protein. So these are the examples of positive acute phase proteins. The first one is serum amyloid A, only remember the names. The second one is heptoglobulin. The third one is CRP, C-reactive protein. The fourth one is RBP, retinol binding protein. There are a lot of positive acute phase proteins, but the most commonly that have been asked in different competitive examinations are these four. Okay. Now we will move to negative acute phase proteins. Here I will write one thing, very, very important. Now negative acute phase proteins. Please remember the names. The first one is albumin. Okay, first one. The second one is transferrin. The third one is transcotin. Sorry, I forgot here one, that is fibrinogen, most important. So, positive acute phase proteins, because of the inflammation, upregulated from lower concentration to increased concentration. And why these are called negative acute phase proteins? These are called negative acute phase proteins because these are down-regulated because of the inflammation. Please understand this concept. For example, I took an example of strangulation in equines. In strangulation in equines, there is an inflammatory condition. With the help of that inflammatory condition, liver of that equine will sensitize that inflammation, and it will produce these acute phase proteins. So, if in a panel you will form a panel. In panel there will be serum amyloid A, heptoglobulin, CRP, RBP, fibrinogen, albumin, transferrin, transcotin. And if a veterinarian in panel finds that serum amyloid A is increased from 0 microgram per ml to 20 microgram per ml, at that time he will make a diagnosis. He will make an accurate diagnosis that there is some sort of inflammatory condition in the equine. So in these positive acute phase proteins are increased, but these negative acute phase proteins in presence of inflammation, these get decreased. Okay, no need to get confused here. These are increased because of inflammation. These also represent a clinical case. These will also represent a clinical case. But here their concentration will be increased because of that inflammation. And here their concentration will be decreased. So please remember the names of these acute phase proteins. And these have been asked in many examinations. Remember one thing here. I will write it here. The most important acute phase protein in case of equines is, I will make some snapshots here. Most important acute phase protein in equines is serum amyloid A. Please remember this. Could be asked in any examination. Serum amyloid A. In case of cattle, serum amyloid A plus fibrinogen plus heptoglobin. These are all produced from the liver. Liver will produce these acute phase proteins. So in most important acute phase protein equine is serum amyloid A. Most important acute phase proteins in cattle are serum amyloid A, fibrinogen, and heptoglobulin. These are also found RBP, CRP, but most important that have the diagnostic value are serum amyloid A, fibrinogen, and heptoglobulin. Fibrinogen helps in the diagnosis of a very important clinical condition in cattle, that is TRP. And a lot of research has been done on this. It makes a good diagnostic value. It has a good diagnostic value in diagnosing a condition called a TRP. What is TRP? Traumatic reticuloperitonitis. We will discuss it later separately in GIT portion of large animals. Heptoglobulin. What is the function? But remember one thing. This heptoglobulin, it's also produced by liver in case of cattle. But remember, this heptoglobulin, it is a disadvantage in cattle. What is the disadvantage? See, in normal cattle, you will see that this heptoglobulin, it's having normal concentration. Okay. But when the cattle gets cowed, when there is parturition in the cattle, when there is parturition in a cow, the concentration of this heptoglobulin is increased. So at that time, you should not get confused that the animal is suffering from any disease. No, there is no disease. But because of the parturition stress, this heptoglobulin has been increased. Please remember this. If there is a question, I will frame a question like, in a post-parturient cattle, the concentration of heptoglobulin is increased. It represents, the option A would be, the cattle is having, the cow is having any infectious disease, the cow is normal, the cow is under post-parturient stress. So your answer should be, the cow is under post-parturient stress. So please remember this, okay? And how does this heptoglobulin help? See, this heptoglobulin, what it does, you might be knowing this thing that bacteria, whenever there is any infection, bacterial infection, there is increased concentration of iron. And that iron in animal's body is used by the bacteria in order to multiply, in order to flourish. So, increased concentration of iron in animal's body is related to the increased infection. So why? Because these bacteria, they utilize this iron. When they utilize this iron, with the help of that iron, they flourish themselves, they multiply at a faster rate. So what does this heptoglobulin do? What it does, it ingests, it digests, it breaks down the hemoglobin. This heptoglobulin will break down the hemoglobin, and you know hemoglobin is made up of iron, and when the heptoglobulin will break down that hemoglobin, the iron is depleted in the animal's body. When the iron is depleted in the animal's body, the infection is suppressed. Okay, understood? This heptoglobulin, what it does, it ingests, it breaks down, okay, it decreases the concentration of hemoglobin in animal's body. For example, there is a cow. The cow is suffering from any disease. There are a lot of diseases. There is a disease called tetanus is there. There is a disease called anthrax. We will take the example of anthrax. The cow is suffering from anthrax. In the anthrax, there are inflammatory conditions, you know. And what this heptoglobulin, it is a positive acute phase protein, its concentration will be increased. I told you, whenever there is any inflammatory condition, in positive acute phase proteins, like heptoglobulin is a positive acute phase protein, okay, its concentration will increase. When the concentration of this heptoglobulin increase, it will digest the hemoglobin. Indirectly, it will deplete the iron concentration. When it will deplete the iron concentration, bacteria, उनको चाहिए iron, वो मौज मस्ती करते iron में. अगर उनको iron मिल जाता, तो heptoglobulin उनको ये मौज मस्ती करने नहीं देता है, iron ही खा जाता है. जब iron ही कम हो गया, bacteria खुद ब खुद मर गए, they die. So this is acting as a diagnostic marker, and plus it has a therapeutic value here. So this is all about these acute phase proteins, and remember this fibrinogen, it has a diagnostic value in this TRP, traumatic reticuloperitonitis. In most important acute phase protein equine is a serum amyloid A. Please remember this. cattle, we have serum amyloid A, fibrinogen, and heptoglobulin. Okay. Now remember, there is one protein that has been asked in examination. That is called heparidin. Heparidin. Please remember this. Heparidin. Heparidin. Please, it could be asked. What is heparidin? It is same as an acute phase protein. What it does, it performs the same function as hemoglobin. It will also deplete iron concentration in animal's body. When the iron concentration decreased, the bacteria do not get the available iron, so the bacteria will die. Okay, understood? So this you need to remember and focus mainly on the examples of positive acute phase protein and negative acute phase protein. Thanks for watching.